Welcome to the Back in Action podcast, where you're going to hear from me, a spine physician, Dr. John Lavelle, and two coaches, Dusty Holden and Josh Bunch. We're going to help you rethink pain, rebuild strength, and regain function so you can get back to enjoying the things you love in life without limits.
Welcome to the Back in Action podcast, a podcast where we talk about strength and conditioning, rehab, spine health, and the mindset of fitness and health. With me today, Coach Dusty Holden, Dr. John Lavelle, and today we're talking about strength training for the desk worker. And doctor, I'd like to start with you. How much of the dysfunction that you see starts from the posture of sitting at a desk all day or the inactivity of sitting at a desk all day?
I would lean more towards the inactivity, and I think that is going to lean towards poor posture. But I think they kind of go hand in hand, because if you're sitting at a desk all day, that's when your muscles are just starting to melt away. Your glutes, your erector spinae, your back muscles, your core trunk muscles, and that's going to cause more of this slouching. So I think as you lose that muscle mass, that muscle strength, then you start getting in more of a poor posture, and that's going to lead to more pain and discomfort. Granted, if you may have be super healthy working out, and if you're in poor posture, that repetitive poor posture will cause it as well. But I think the bigger thing that I try to focus on is more that, strength training and losing that muscle mass by being sedentary. And that will help fix, if you fix that, that's going to help fix your posture, and you're going to be able to sit and be more active. Whereas if you don't touch the strength piece and you just try to work on your ergonomic chair, you just try to sit straight, pull your shoulders back, that's just not sustainable.
Is it even possible to do that? Can you just tell somebody, hey man, you need to have your shoulders back? Can you even just tell somebody that, and just to be able to do it through the day with the way that society is organized? Is that even a thing? Can you be mindful enough to get out of that behavior?
No, and I think even if you can, the amount of time that you're able to do it is, so minute in the big scheme of things that, most people, I would say that's even an issue, is they don't know how to even activate
what an
certain muscles.
Position is.
Exactly.
I wonder how many of our listeners and folks at home watching just sat up a little straighter. Yeah. Did you? So what do you see, doctor? Like when people come to you that you can point to, do you ever say like, "Hey man, do you sit all day?" Like, or do you get?
Absolutely. I always ask what their profession is.
Okay.
What do they do for their lifestyle? Are they working? Are they not working? If they're working, what type of job do they have? Are they sitting at a desk all day? Are they at a computer? Or, what do they do? Are they on the phone a lot, which with their head tilted, is that causing their neck pain? Are they more at a desk or some kind of chair where they're just kind of hunched over, sitting 6 hours straight at like a call center where they can't get up and they got to make their money by answering those phone calls? So that's a huge component.
That's
you got to know
the history that you have coming in first and foremost. And then when they say something like, I sit, is there a time frame that you're like, oh man, more than 4 hours, red flag? Or
I think if you're just sitting for more than an hour, that's almost a red flag. Yeah,
okay.
You got to be getting up and moving a little bit.
Okay. What is the most common thing that you see out of that? Is it is it kyphosis? Is it what's going on the most?
Yeah, just I would say low back strain from those muscles getting deconditioned and weaker, and getting pain in those facet joints. Usually those arthritic joints. I would say that's the most common. I would say sedentary desk workers are probably the most common back pain patients I see. Okay. Whether it's low back or neck, it can be both, but often it's the low back.
Say that one more time. So you would say that sedentary desk worker is the most common, that's what relates to the injuries that you see the most? That's the most common? So it's
Absolutely.
Not somebody who's active and doing something.
No.
It's the opposite. It's not
yeah.
I was picking up X and X happened. It's I'm not doing anything and X happened.
Correct.
Well, I would say too, even like
that's big.
In the patients that you send over, it's that, or it's the retiree who now is just inactive and just sitting.
Agreed. So that sedentary lifestyle, we're talking more desk workers, but sedentary lifestyle, absolutely, that's the most common common cause of back pain I see. And the literature bears it out. I wrote down a bunch of studies. I found over 200 legit studies on sedentary lifestyle, back pain, and what helps improve that back pain. And universally, it comes out, especially over the last 10 years, that strength training for people that are sedentary is the most effective treatment. But
So
there's
everything that we could apply, be it injections, so on and so forth, all the way down the road, any sort of physical therapy, massage, dry needling, you're saying that strength training by far outweighs all of those.
Yeah, absolutely. I mean, there's a 50 to 63% increase incidence of back pain in sedentary workers.
And it's, again, sedentary, so it's no activity. It's not, I'm lifting a whole bunch of things and therefore.
Correct.
It's the opposite of that.
In these studies, this study in the Spine Journal in 2020 compared active workers versus sedentary workers, and up to a 63% increase of back pain in the sedentary workers versus those that are active. And that we've seen that with studies comparing, former NFL players, their spine actually degenerates slower, even though you think they're getting hit, they're active, they're also staying in shape and conditioned. Their spine on an MRI or imaging looks healthier than the sedentary person.
Is this the sort that I would have been sedentary for however many years, and then I went to do something, and then I'm going to blame the something? So I've been sedentary for 4 years. I went to pick something up, and I'm like, oh, I blew my back out. Is it more because I was sedentary, not because I picked something up?
Absolutely. 100%. But even the patients I see, it's usually not even that. It's they can't see that inciting incident. It's just, all of a sudden my back started hurting.
Well, and I think too, due to the just lack of movement, the fact that they are now moving, one, I think there's a definitive line between being sore and pain.
Explain that to me. Like, you mean as a desk worker, like they're sore because they just sit?
Yeah, I mean, if you're a sedentary and all of a sudden, you get up and do 20 air squats, you're probably going to be sore the next day. But being sore from, using certain muscles is very different than acute pain.
So this is almost like a pain tolerance or a baseline, like my baseline from sitting.
Well, and it's so low now because of the inactivity that even just the soreness is now confusing, and they think, oh no, this is pain.
Yeah.
And so a lot of people's tendency, even after the first couple of sessions, is this is not good. I'm hurting. I can't get up, or I can't sit down, whatever it is. And it's just not the case. I think that's where us as trainers, we're very delicate in those type of situations, because we know where their default mindset's going to go, and we don't want to. We want to elicit a certain response, but we don't want to go too far, and then it end up, kind of discouraging.
Yeah, you have to have the adaptation. You have to have enough stimulus.
Exactly. So it's just the right dosage, to kind of get us moving in the direction, but we also don't want to just destroy somebody and them not want to come back.
But this is also what our podcast is about. A lot of times it's the education component, and you are fantastic at it, and Dr. Vo, you're fantastic at it. You're just knowing that I'm going to be sore, or that this is going to feel uncomfortable in the beginning, might be enough to tamper down that central nervous system response.
I think you have to set the expectation.
That's right.
Because if they go into it thinking that you're not going to be sore after not not exercising for the last 10 years or ever, maybe, you're wrong.
But then also, speaking to what you said, like, about your, when I was 18, I was a superhero, and I haven't done anything since then. You have to kind of go the other way, where I'm sure you see this. I wanted it to feel like I had the best workout ever the first day that I came in, and that's not. You just said that's not what we're going for.
No.
We're not looking for the.
You're not 18 now.
Intense. That's right. How do you get through that? So when you're coaching an athlete who's been an athlete, superstar. And then they come into you and they're like, I feel like I haven't done anything. What do you do there?
Well, I think you just talk them through, the process of what you're doing. Get somebody to do 20 air squats, and if they've not been doing anything, they're probably heart rate's elevated. They may be breathing heavy, and now all of a sudden, they got lactic acid in their legs, and they're struggling to even walk. I think it's just talking them through that. Hey, listen, you've been out, for whatever X amount of years, and now we've got to reset the expectations and where you are. This is just, we got to accept the fact that was 20 years ago.
Yeah,
and a lot of things have transpired. And I think getting people to understand, I would say that's probably the biggest misconception in fitness is people, once they start training, they forget how long they've been out, or maybe how long they've never done anything. So it's like, you're not going to do 2 or 3 workouts and all of a sudden, transform yourself.
Yeah.
It's a process. You didn't get here in 2 or 3 days. You're not going to change that in 2 or 3 days. You're not going to change it in 2 or 3 weeks. You will begin to move the needle in 2 or 3 months. But it's all about just, stacking that consistency and just helping them understand that, I think, is probably the biggest piece. It's just realistic expectations. Don't be afraid to talk them, through it.
So where we're at when we start out needs to be a tolerance testing. Hey, we really want you to leave like you don't really feel like you did a whole lot.
Yeah.
And each day we're going to add on. Instead of you feeling like we kicked you in the teeth, it's going to be more like, I'm sore,
well,
but I'm okay.
It doesn't take like real knowledge and talent on our part to just destroy somebody.
No,
like we can very easily lay somebody out.
100%.
But
that's
it
nothing
takes
to be proud of.
No,
it's really
because it's very easy to do.
It's harder to go the other way. To establish the right amount of volume for the right athlete.
And moving them and progressing them at the same time.
That's right.
So I think that's the key part. When you find somebody that can do that for you, you need to stay with that person.
Yes, 100%.
To your point too, though, that 18-year-old that used to be a superstar athlete and now is 40 and hadn't done anything for 15 years in between, they often will kind of understand when we present them that idea of you're going to be sore after you start moving now. This is the long-term treatment. It's not going to happen overnight versus the person that's just never done anything and it's been sedentary forever, never really exercised or did anything. When they go to the gym and they feel that soreness afterwards, it's harder for them to realize this is part of that process. Exactly.
Yeah. Well, go ahead.
In your particular approach and how you treat patients, I mean, you use injections majority of the time so that people can come train.
Exactly.
It's not for them just to, again, you just diminishing pain. Well, that's not very hard to do.
Right, exactly. Anyone can do the injections. And I use them, like you said, and I explain this to them, the injection is not the cure. We're doing this injection to quiet down your nervous system, to decrease inflammation, and ultimately pain so you can move. There's no point in doing an injection if you just want to do it every 3 months for pain relief, because that's not the long-term treatment. It's not the right thing for me to do. It's not the best thing for you long-term for all the side effects you can get from injections on bone health, muscle mass, cortisol levels, everything. So the injections should really only be used, and that's how I use. Same with anti-inflammatories or oral medications as a way to temporarily decrease that pain. So while you're pain-free, you can start moving and not have any major setbacks.
That's a good word. Yeah, that's a good word. So just to be clear, you give me an injection today, you're going to want me to go be more active. That you gave me the injection so that I can be active to strengthen the position of dysfunction.
Right. You don't need the injection to go do it, but it's often going to allow you to feel like, okay, now it's safe for me to get moving.
Yeah, it's more from a confidence.
Yeah, absolutely.
Now, we talk about this a lot. So if I'm 20 years inactive, how do you bring that subject up? So if I need to hear this, what do you say to that person that's, they're on the edge and they've never strength trained before, but they're in pain? What do you tell them?
It's really hard when they're 65, 75 to get them to do that, but it's the same thing I explained, and you got to kind of take it slowly with them and really educate them why this is going to help. Because if you just say you have some arthritis, now go to a therapy session and that's going to fix you, they're not going to buy into that. They're mentally going to be just checked out and say, this is all he's telling me to do is exercise or move, and they're not going to go in with that full head of steam that they believe this is going to help. It's that getting back to that mindset. They have to really trust what you told them and then be able to take that forward when they see you guys or physical therapy and believe that what's going to happen to them is going to make long-term change. So you really got to take a good history, ask what they do for a living, and explain to them on it. You can see a lot on exam and then sometimes imaging too, when they've been sedentary and explain this to them, you're sitting all day. So when you're sitting, your hamstring's shorter, so the hamstring can tighten up. When you're sitting, your hip flexors or iliopsoas muscle is in a flexed, shortened position. That can be tight. That's why it can be hard to stand up and cause discomfort. Sometimes in the hips, often in the low back, because it's pulling on the pelvis forward, if it's the hip flexors, which increases curvature in the spine, that lordosis, and puts more pressure on those facet joints, which get arthritic as we get older, as we've talked about in the past. And so that can start to get irritated.
You said a couple of words there like lordosis. Explain to me what that is.
Just
so that our
a
listeners know.
C-shaped spine in your curvature. That's a normal curve in your spine.
You're saying
it can get exaggerated
okay.
with the anterior tilt. You can lose that curvature when the hamstrings are tight and pulling the pelvis backwards.
Okay.
So when we talk about these muscles, it's focusing on the spine, but as I tell all my patients, our body is a unit. It's connected. If we just go in and focus on your spine, don't do anything with your legs, you're not going to get long-term improvement. And I say that all the way up to the neck, because if your pelvis is off, that's going to pull on the fascial tissue in the spine. It's going to be harder to get out of this position. So I just recently, last week, had a patient call and said, Dr. Lavelle gave me the wrong set of exercises for my therapist. My therapist didn't understand. This didn't make sense while we were doing leg stuff. And I said, well, one, we're going to send you to a different physical therapy location. And two, our body is connected. You have to strengthen your legs. If he just works on the neck, you're not going to get that long-term treatment we're looking for.
So many more people need to hear that.
Yeah,
that's
absolutely.
exactly right. Now, you said shortening of the hip flexor. So Dusty, if I toss that at you, if something short and feels tight, do I need to stretch it? Shouldn't stretching and mobility be all that I need? Why do I need to pick up these barbells or move these dumbbells?
Well, because not only do you need to get some mobility, but you also got to strengthen the muscle, because one of the reasons that it's now shortened is because it's deconditioned.
Okay, so mobility and flexibility are different than strength.
Oh, yeah.
Okay.
Yeah, but I would say that's a great place to start.
Okay, so if I'm
because that could, even in that, with some strength, stretching and mobility, you're probably going to see a decrease in pain because you're moving. And chances are, especially if we're talking about the psoas, you're just sitting you've been in that same position for so long. Now, if we move you from flexion into extension, well, a lot of times even the pain goes away.
Yeah, and then just so flexion is that
rounding.
That question mark. Yeah, and then extension would be the opposite. Opening up. Okay. So if I'm going to do that, then can I just get up every hour and move around? Isn't that enough?
It's a start. Like he just said with stretching, that's basically stretching it and moving it, but you're not going to see. You're going to get back into the same spot, because you asked me initially, I said it's that loss of muscle mass. Skeletal muscle mass is the key to longevity and a healthy lifestyle. If you are losing your muscle mass, your lean muscle mass, your skeletal muscle, you're at some point in your life, you're going to be in pain in your spine. It's almost guaranteed. Or other joints as well, hips, shoulders, because you're going to still be moving those joints, that back. And if you're losing that muscle mass, that support around it, that underlying arthritis is going to get irritable. You're going to irritate it at some point. So you have to maintain that skeletal muscle mass. And this is just for musculoskeletal health. We could get into down the road all the other reasons why that organ of the skeletal muscle is so important in our life and longevity. But for this conversation, if we don't do that strengthening piece, you're not going to see long-term improvement in your back.
And this is where I get that short, where the muscle feels short or feels tight, which is more like a sensation, not necessarily a diagnostic. My body will naturally start to take away range of motion, because no longer am I confident with my strength in that range, correct?
Yeah.
So to get back to the range of motion, we can use the shoulder as example. If I can get my shoulder to my ear, but then that starts to go away, would it be safe to say that if I would make that joint stronger without even have to worry about stretching, that I might be able to get back that range of motion? So all of the stretching in the world might not work when I need the strengthening component.
Yeah. Okay. So it's very likely.
Okay.
It's with the sedentary position, as you guys were just talking about, we're in this position. Whether you're working in this position at a computer, sitting the whole time, even on a standing desk, you're still forward like this most of the time, or you're going to end up that way towards the end of the day. Or if you're older, you're retired, as you were talking about, and just sitting slouched in a couch or in a chair, or at your grandkids' games, you're always sitting in some kind of position, this position. And what is everyone fearful? Majority of my patients said, I don't want to just end up like my grandmother who was always like this, but her mother was like that and her mother was like that. So it's not genetic. That's BS. It's because those back muscles are weak. So I always say, well, what are you doing to train those muscles so you're not in this position? And I'll even, as we've talked about, show them the MRI where you have all this fatty infiltrate in those paraspinal, the erector spinae muscles. So you've lost that muscle mass. So of course you're going to fall forward.
Yeah.
But if we work on strengthening that, that's going to naturally pull you up. You're going to sit straighter. That's going to fix that posture, but it's also going to keep your spine, those normal, as I mentioned, lordosis, that curvature is going to stay the way it should be. You're going to take pressure off those arthritic joints. That's why stretching is good, but it's just not enough.
So
Getting
it's okay
up and walking every hour is good.
That's great.
But it's not going to fix the problem.
So temporarily, that's solving the immediate issue.
It's preventing that psoas muscle or those hamstrings from getting super tight, but it's not preventing them from atrophying over time.
Because it's not strengthening anything.
Exactly.
It's just moving the thing. But
that could be beneficial.
Sure.
I mean, especially if you've just been sitting and doing nothing, you're going to see benefits from stretching initially. That may go a couple months. And then you're going to be probably back to the same.
Or not as good as you want to be.
Yeah.
And to be realistic, I mean, we're not telling people who are a desk worker to quit their job. It's probably not going to happen.
No.
Right? And we're probably not going to be able to tell them, okay, well, you need a stand-up desk, you need to be at this, and you need to have your shoulders back and all of this kind of stuff. So we're probably going to say something like, yes, get up and move as much as possible. And if that's the case, if that's where I need to start at, how much movement and how often if I'm working at a desk? We'll say 8 hours.
I like every 30 minutes because I think you start going over 30 minutes and you just lose track of time. If you're literally at a desk over, an hour, the chances are you probably don't even realize how long you are really sitting there. So
is there something formal that I should do every 30 minutes? Is there a time, like I get up for 1 minute every 30? Is there any just quick protocol that takes me from thinking about it? I can just get up and do what you said.
I would say, get in the habit of moving every 30 minutes. It could be a walk to the water fountain. It could be you get up, you do, 15 or 20 air squats. Okay. And then the next time, maybe you're just doing some hinging at the hip. I mean, who knows? Maybe you drop down, do 10 push-ups. It's just anything, obviously the more fun you can make it, I think the likelihood of you continuing to do it is probably higher. But you could also create little challenges, within the office of, hey, in this 6-hour shift, let's see who can, do 100 air squats. So
this is like an exercise snack. Every 30 minutes or so, I need 20 seconds or 5 minutes. Or
and it doesn't take that long. It's not like you got to get up and go as fast as humanly possible. But, I mean, if you're up, a minute, 2 minutes, just that movement, I think, again, it's going to get the heart rate up. It's just going to help you clear your mind. You're probably going to be more productive, but physically, you're just going to feel better.
Yeah.
When I fly, I always, I have to get up.
You're one of those guys.
I am. And I just can't.
And you see those guys in the back of the plane.
That's right.
They're all doing some squats, or they're walking the aisle, and you're like, those guys are crazy.
And the flight attendant always comes up and like, can you sit down?
Yeah. But it's like, I've conditioned my body to move.
And it hurts. It hurts when you just sit there.
Oh, I mean, 100%. It will wreck my back.
Yep,
and
100%.
So my body is just so used to moving that when I sit, then I like actually getting pain from sitting.
Right.
So I think there's just so much, magic in that movement piece, and that the more you do it, the better you feel. And then it's just this like continuum where you want more of it.
It's funny you should say that. I think a lot of athletes, a year or 2 years after working with us, they'll go on a vacation and their activity significantly goes down, and they always come back and they're like, I don't understand why I was in so much pain. And yes. When they're here working out, they're great. And then now they see what they used to tolerate, and no longer is that acceptable.
Well, we constantly are telling people, a body in motion stays in motion. And so the more you move, the more your body wants to move. And the same if you are just sitting and you're resting. The more you sit, the more you rest, you don't get motivated. The motivation doesn't increase for you to move. It actually increases for you just to stay there. Like you just want more rest. You're never going to get enough of it. So I think that's like, where do you want to be? Do you want to be because the pendulum swings hard the other direction. And I think, obviously the research is there and movement is clearly, much, much better than the resting side.
Now I've been there. So let's say I've been there for years and years. I'm gonna believe what you're saying.
Yeah.
Are there movements that you would say, I've been sitting at the desk for 5 or 10 years? Don't do those, but do these. Are there movements that you would think would be worse, better? What do you recommend? Off the table movements altogether right when I'm starting out, or is everything on the table? Is it just a smorgasbord of fitness?
I would say there's no limitations.
No limitations. Okay.
Now, if there's certain movements that are bothering you, then back off some. But there's no strict movement that's going to worsen it, obviously.
Okay.
And again, it's hard to say that because you got to make this stuff individualized.
Sure.
So is it their hip flexor that's tight? Is it their hamstring? Movements that obviously, if you're sitting, are going to extend you, open up that hamstring.
So when we're talking about hip extension, we're talking about having the knee behind the hip. We're talking about lengthening the joint into extension as opposed to shortening.
Yeah.
Okay. So you're saying if I can find hip extension more often, that's probably going to be a safe bet. I think doing
like we say this all the time, but a deadlift type activity in the office, that's going to work on your glutes, your hamstring. It's going to extend those hip flexors. I think that would be a great one. Just that hinge, even if you can't get up, if you're on a desk, just bending to get your toes and then sitting straight up is
so muscle atrophy is when the muscle actually goes away.
Shrinks.
Shrinks
from
down.
what?
Disuse.
Okay, so if that's the case, we keep talking about things that are on the back. Are you saying that posterior muscles, things that are on the back side of the body, are the ones that is going to shrink or atrophy the soonest?
I had highlighted one of those in 2021. An article in the Sports Medicine Journal specifically showed that posterior chain strengthening, those erector spinae muscles, is the most effective strengthening for chronic, non-specific low back pain.
Say that one more time.
Posterior chain strengthening, or the erector spinae muscle specifically.
Okay, which are the two muscles that go down the bulk of the back. Okay,
is the most effective muscle group to train with chronic low back pain.
Okay, Dusty. Now, if that's the case, and I know that we ascribe to that, how often should I train that musculature? And you could either just give me a straight up how often, or as it relates to training the anterior.
I would say at least 2 to 3 times a week.
Okay, so training posterior work. Yeah. So give me exercises that you like to include for the desk worker.
They're gonna go, this guy always talks about deadlifts. I mean, that's the lowest hanging fruit exercise, the deadlift. Yep. And it's, I think, the one that people are the most terrified of.
But you're not going to start somebody with that. You're telling me something that is a great idea, but if you've not been doing it.
Well, there's so many ways for people to scale and to find a variation of the deadlift that they can do that it's literally endless. So there's no reason to look at that movement and just put it off the table, because it's just our bodies were created and designed to do it.
Yeah.
If you're eliminating it, you're holding yourself back. Your back is not going to be as strong as it could be. Now, there's a lot of different things that you can do to strengthen your back. I think the whole point of the podcast from the beginning was not for us to get out in the weeds, though. We want to try to simplify all this stuff enough to where people can take something and go do it. Right. Kettlebell swings.
So that's a ballistic hinge as opposed to a slow.
And so, another movement that I would say people are scared of, but then it's also, you can do that. You can simulate that same movement pattern with a band. And so now you don't have this free flowing object, where it can be challenging to maintain positions. But again, I think what I want to reiterate to people is your spine is created to move. It's not created just to be locked down. That's the other thing about the deadlift is we put so much emphasis, especially in our world, on the positioning. You got to get into the right position. But in life, rarely do we get the opportunity to set our feet, brace our core, do all these things before we, grab whatever it is that we're, doing. So I think that's the thing. Don't be scared of certain movements. And if you are scared, you need to figure out why. Why, what is it? Maybe it's that you injured yourself doing it, or maybe you've just heard, a lot of negative talk around whatever it is, and that's what's got you kind of shying away. But I would tell people you're going to cause yourself more harm by avoiding than you are then like challenging and learning to do whatever that thing is that you're like the most scared of.
Doctor, how many times have you heard that sort of somebody's painted my perception when they come to you and you're like, oh, strength training would be great. And they're like, no, I've heard that it's bad. I've seen on social media that somebody got hurt deadlifting.
Well, they're scared.
Yeah.
And usually they've been told, that's been a narrative for years in medicine, is don't hinge at your waist, don't bend at your waist to pick something up. You got to bend and do a squat type activity to lift it up. That's just not practical if you're going to live a life.
That's right.
I mean, you have to hinge at your waist. We've talked about this ad nauseum on this podcast. If you're not training that hinge movement, then you're screwed. You're not going to be able to live life, and you're going to get atrophy of those back muscles, and that's just going to compound the problem. It's great for medicine, I guess, because that means more procedures, injections, medicine handed out, which means more money in the pockets, but it's not the best for the patient. You have to be training those posterior chain muscles. You were just asked, what movement should you avoid? I would, like I said, I try not to be that negative side and say avoid this. It's more what should they be working on, and it's those back muscles and those glutes. Avoid that kind of dead butt syndrome. You got to strengthen those glutes.
Dead butt syndrome, is that a technical term?
It's a Lavellism.
Oh, okay, got it. Just curious.
You have to, dead butt syndrome, I just mean it. It's when you get atrophy, your butt melts away just sitting at a desk all day long. You're going to throw off your pelvis. So then you wonder, why does it hurt going up and down stairs? Well, if you're trying to step up, your glutes aren't activating because they're not there. So you're having to move and contort and lift up your spine. Obviously, that's going to irritate those joints back there, those discs in there, the ligaments in there. If that's not strong, you're going to be in poor shape because you have to use your pelvis for so much of what we do. And if your glutes aren't strong to support that, then you're going to.
And this is what we see where the quad gets over tight and sort of becomes the abs and becomes the glutes, or starts to recruit in really awkward ways. Then we get back pain or back fragility, knee pain. Knees feel fragile whenever I do anything.
Yeah.
Now, you've mentioned deadlifting. Let's say that deadlifts are a little off the table in the beginning. Like, we're not going to start with that. Give me a couple exercises that can pull my shoulders back, and then give me a couple exercises that I could do maybe for the lower body posterior chain that wouldn't be a deadlift per se.
So here's what I would say, because we said 2 to 3 times on the hinge.
That's right.
I would say every week you need to squat.
Okay.
You need to do some variation of a hinge.
Okay.
And you need to press something over your head.
Okay.
So
if I worked out 3 times a week, that's a good pattern to follow. I need to squat, press, hinge.
Yep.
Okay.
Change it in as many different, variations of those movements.
What would be an example of hinging?
I mean, anything where the hip is hinging to like 90 degrees.
Okay.
So like we said, kettlebell swings, we said you could do it with a banded pull through.
Could be an RDL.
Could be an RDL.
Okay.
You can use a trap bar, barbell, dumbbells, kettlebells.
Explain an RDL just for the listeners.
So an RDL is just, you're not bending the knee as much. So it's minimal knee bend. The emphasis is more on hamstring, glute. Okay.
And then when you take it through the orientation of the pelvis, you're getting a little bit more. If you keep a neutral back, you're getting a little bit more of the glute. If you have a little bit of an extended back, you're getting a little bit more of the hamstring. If you have a really extended back, you're getting a little bit of the adductor. So just those little plays constitute, do I need a coach to help me walk through those things? And then we could talk about, if we're talking about upper body, what about if I could do pull-ups? But what if I couldn't do pull-ups? Because that's obviously posterior.
Yeah. So then, you can do rows.
Okay. Like a ring row.
Yeah, ring rows. You could use like a supine row with a barbell.
Okay.
And the same thing with pressing. Maybe you've got something going on with your shoulder where you can't press overhead. So find an angle, a variation of it that you can press in.
So it might lie on a bench.
It could be a push-up.
Okay, push-up. Yep.
Yeah. You could be using a landmine, and so now you're pressing, kind of in between.
A little 45-degree
those.
Angle press. Yep. Okay. And you would do the pressing as it relates to the pulling. How often? So am I doing 2 pushes for every press, or am I doing 2 pulls for every push? Is there a ratio that you like?
I would say I would really say do the pull 2 to 1 over the push.
Okay, more pull.
Because I think your pull, again, we're talking more back specific. That's going to hit into that like upper back.
Pull twice.
And again, change the variations. Don't always. I think that's where people run into roadblocks with their training. They find something and it works, and then they just do it over and over for years. And then they just eventually just hate doing it. And that's not the way.
It's not the way we do it.
I mean, yes, there is something to be said for consistency,
And the basics.
Yes, master the basics,
right.
do them consistently, do them very well. But you also you need to mix up your training so that your training remains fun, and also so you can continue to progress. I mean, if you're just always doing push-ups, you're going to get, it's like running the 5K. But then you go try to run a marathon and you die. Well, if you're just doing push-ups all the time and then you try to press a 45-pound barbell over your head, chances are it's going to be really, really hard.
That's right.
So you need to be training all those ranges of motion and movement patterns.
I think our listeners need to hear that again. You've been training forever. So what are some of the ways that you today have been able to maintain that? How have you made it fun for yourself?
I change it. I mean, he trains with me 2 days a week. About every six weeks, I switch the
program,
the training. I don't tell him. We get probably a week in. He's like, "Oh, we're doing a lot more of this now." It's like, yeah. So
you need that variety.
Yeah.
It has to be. It's not just variety for you to be fun, but it's also that dynamic change, the way you're changing that hit to your muscles. So your muscle cells are being challenged. So hormonally, things will change differently. Neurologically, your nervous system isn't getting sensitized to what you're doing, so you don't reach that plateau. You're constantly challenging that neuromuscular system, so it continues to hypertrophy, and at least maintain that muscle mass, and that nervous system doesn't get sensitized, so it's used to doing the same baseline. It doesn't have to be anything crazy, but that is the hardest challenge I see with patients is they'll get on a good path, they'll be going to the gym, but then I'll ask, so what are you doing at the gym? And it's the same circuit 3 days a week now for 3 months, and they got better, but they're wondering why they're just not getting over that hump.
So the conjugate method is roughly 3 to 4 weeks in a deload week, and you intersplice different exercises through. So it's similar to that. You're talking about 6 weeks, and this would be what you're talking about, doing the exact same thing. If I just wanted to do push-ups and then a horizontal row, and I did that for a year, all of a sudden I tried to do a pull-up and then a vertical press, it might be game over.
Yeah, it's probably going to be more challenging than it was before.
Same thing of unilateral versus bilateral. If I walk in and I squat all the time, but then the day that I have to do a step up, or the day that I have to lunge, and then if I have that asymmetrical weakness, my left side doesn't keep up, I might have just discovered a huge hole in the game. And then would you be able to relate that to like a back pain? All of a sudden, I can lunge 200 pounds on my right, 50 pounds on my left. Maybe we should work on that asymmetry.
And that stuff happens. We see that very rarely, though.
Right.
I mean, even in our world, and in when you see patients, it's very rarely do we have that client who has bumped into something like that. We see way more of just people not doing anything.
That's right.
So I think the point is, find something that works. And in the beginning, if it helps you move the needle and progress, then great. But eventually, and I would say the moment you start losing interest in it, that's a good indicator. Like, hey, you need to mix in some different
activity.
But maybe you need to change the lifts that you're doing. Maybe you need to go from compound to bilateral lifts. So I think that is the beauty, though, in it. That's really the fun part. It's endless. You don't have to get bored with it, and it should be something that you enjoy. And if it's not, then that's where you need to find a coach or somebody that can lead you and direct you and help you continue to progress.
That's what I was going to ask. You could say something like you can find a million programs out there. You could have AI create you a program. But is that the best idea, or do I need a coach that's going to be able to give me something tailored specifically for me? Not just a program that exists in time that looks good on paper, but something that's right for me.
I think that could be a great place to start.
Okay.
If you're somebody and you're just looking for a framework, then yes, the options are literally endless out there now. And it's so available. I think we just live in a time where that's no excuse. Like if you're sitting here saying you don't know what to do, that's just because you're not looking. But I think there also becomes a time where if that was literally the cure, we wouldn't be where we're at, like we wouldn't be where, 75% of our population is sedentary and obese. So it's not an information problem. It's really like an initiation, like doing it.
And that's why I think initially, for me, it's sending them to good physical therapists or good trainers like you guys, because they then build that trust and confidence. So if they just go to a online form, a lot of insurance companies have it's called Hinge Health, where they'll send them some exercises to do, and that's great, but it's hard to necessarily follow through with that because you don't really have that accountability. But if you're working one-on-one with someone, they're teaching you what to do, some variety in those exercises, how to do them properly. You're going to learn how to do it, and then I think that's the time where people can branch out and start to do things on their own or have an online program if that's what's going to work with their schedule. But I think initially, seeing someone like me and then following up with someone like you guys to really implement what I've kind of told them they need to do teaches them what to do, so then they can go on and do it for the rest of their life.
Very true. If you could give a desk worker one habit to change today, what would it be?
Without thinking of any limitations,
Today.
They have to be in the gym exercising.
So for
2 to 3 days a week.
For real workout. Movement's great, but we need an actual
getting up and doing those, exercise snacks, as you mentioned, and doing a minute of, air squats. That's all good, but everyone, especially desk workers, have to be training some way with some resistance training to strengthen those muscles and avoid that sarcopenia, which is loss of muscle mass, which we've talked about, and preserve those muscles and build them up, because as your body breaks down and you're inside of you, those joints get arthritic, those discs start to bulge. If the skeletal muscle's not strong around it, you're going to have back pain. So the way to prevent that is you have to be strength training. So more than just movement, you have to ideally, if you have a good setup at home, but ideally be in a gym, because then you can get that variety and you can diversify what you're doing and not just the same 10 exercises every day, but actually pushing some weight and lifting something.
Dusty, same question. If you had to change one habit today that a desk worker could work on, they're listening to this right now, is it something different? Is it the same thing? What you got?
No, I would definitely reiterate what he said, but I would say you have to get up. Get up and move. I think that is a great place. If you're sitting and you've listened to this in podcasts and you've been sitting the whole time, that you got to get up. Get up right now and move. And even if it's for 2 to 3 minutes, and if you will start to do that and stack that on consistently, where you're doing that every day, multiple times a day, and you can do that for 7 to 10 days, I'll almost guarantee you're going to feel better. And then once that's happened, you've got some consistency. You need to you need to find a gym. You need to get plugged in and start doing some strength training. 21 days, right? That's what it takes to create a habit. So
I think so. Yeah.
Go 21 days. Move every day, and by the end of that 21 days, have yourself plugged into a facility where you can get a hold of some weight, and let us know.
Yeah.
How you feel. You're gonna feel better.
So to recap, sedentary lifestyle is the reason for the majority of the dysfunction that you see today. The way that we can take care of that is get up right now. Start moving around at the desk. It's okay that you got to work at a desk, that's fine. But get up, start moving around. After I've started that, I need to work out 2 to 3 times, train 2 to 3 times a week. And while I'm working out, I'm really looking for doing something like 2 pulling exercises, 2 posterior related back of the body exercises for every pushing exercise.
Yes.
Gentlemen, thank you for your time.
Thanks, man.
Nice work.
Thank you for watching. Join us for much more where that came from. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.